now let's take a look at the nose. We can see there are some irregularities to even the frontal view, where we can see a little bit of irregularity here, a little irregularity there. So these things are important when we consider something called the light reflex, which is the way in which the light bounces off the nose on frontal view. If we then turn all the way to the side, as we've said before, there is a dorsal curvature and a slightly drooping tip, and we have a dorsal hump and then an area here which we can add volume to straighten the nose. We've always got to be very careful to consent the patient appropriately for nose filler treatments, because as we know, the vascular supply is particularly high risk relative to other zones of the face. I'm going to take a moment to explain that with a summary of the vasculature to the nose.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
So here we have our supraorbital foramen, and we have our supraorbital and supratrochlear arteries emerging in the forehead. We know that these are branches of the internal carotid circulation, also particularly in this scenario, the ophthalmic artery. So the ophthalmic artery is a branch of the internal carotid circulation that has a vessel that supplies the retina, called the central retinal artery. The nose has a vascular supply from three major directions. We have the ophthalmic artery, the branch of the ophthalmic artery, which is the dorsal nasal artery. So that's coming down in the same way that we have these vessels. And this is our crucial connection with the internal carotid circulation. We then have the facial artery coming up, which is then becoming the angular artery towards the nose. And the angular artery has an anastomosis here with the internal circulation, in some cases called the alar artery, which is where we get connection from the external to the internal carotid circulation. So this is not always present, but when it is, of course, we do have a direct connection from the external to the internal carotid. We also have our infraorbital artery deep down here, and there are some branches, some medial branches that come deep from the infraorbital artery to connect up with the nose circulation. And remember, we also have the superior labial artery, which then gives rise to the columellar arteries, which run just under the skin up the columella. And because of this complex vascular supply, we have an unpredictable location for the vessels, and we want to be very cautious in terms of how we're injecting. And so that means that we have some rules to follow when we're injecting the nose, but the most important rule to follow is that we're always going to be consenting our patients appropriately, and if we can avoid injecting, even better. If we are going to inject, we've got to do it in the safest way possible. And for me, that includes using a cannula where possible, and if not using a cannula, then we're using a needle in the right places, in the right depths, and also aspirating. So I'm going to show you how I would approach this with a cannula, treating the dorsum of the nose and also lifting the cartilages at the tip of the nose to create some definition at the tip. We'll start off by drawing on these aesthetic lines. So if you rest your head back, we're going to follow the brow all the way down to the tip. And these lines contain where we want the definition of the nose to exist. Any interruptions to these lines is what will start to grab attention when we're looking at the nose, particularly from a frontal view. These lines connect the medial head of the brow all the way down to where we want the tip of the nose to be. So now I've got those lines, it's even easier for me to stand at the top of the bed, chin up, and see where we do have little irregularities, for example here, or here, or here. All of these are areas where if we're going to use filler, we can just help to create even more balance. Turn your head this way. So this gives me an idea of how I would treat the dorsum of the nose. Separately, I see that the tip is slightly drooping and I want to create a little area here where I want to create some new definition for the tip of the nose. And to do that, I'm going to have to treat both the columella and give a little bit of a filler deposit right here. The final thing to say is the bottom third of the nose has no layers. We're just skin, fatty tissue, and then cartilage. And then the upper 70% of the nose, we have our 5 concentric layers where we want to be injecting into layer 4 in the nose because the blood supply runs more often than not superficially. So the right depth to inject is in layer 4 in the upper 70% of the nose. And then in the tip of the nose and the cartilaginous nose, we just have to be careful to be injecting in the safest way possible. The columellar arteries are running just under the skin, so I'm going to be deep against cartilage for the columella, and again the same onto the perichondrium to create that nose tip. So let's get started with my lidocaine. The lidocaine gives me my comfort for treating for injecting the cannula entry point. The entry point is just where the nose drops off. So little scratch, a little sharp bit. This is the sharpest bit, okay? So just bear with me, Gabriella. I know this is going to make you sneeze. Okay. But once I've done this, it all gets better. Okay. Now, the cartilage of the nose and the bone of the nose are, of course, firm, hard structures, and that tells me the kind of product that I want to use, which is in this case a projecting high G prime product. That's Revanesse shape. And I'm going to start off with the tip of the nose, and then I'm going to work my way up the dorsum. So I've got my 25 gauge cannula here, and my entry point just facing where I want to go. But remember, I'm also going to have to go downwards as well. So I leave that in there for a few seconds to make sure I haven't cannulated anything. The nose is highly vascular, and so we can expect this to happen when we make our entry point. The blood supply comes from the side, and so if we squeeze from the sides, the blood stops. Okay, so we're in position. Passing the cannula down against the cartilage, down the columella. Can be a bit sore, well done. Touch down. And here we're going to now give a strip of product to really give support to the base of the nose. Fantastic. Whilst I'm here, I'm also going to give some definition to this tip here. Remember that there are no layers in this part of the nose, so I'm really injecting into this fibrofatty tip, and doing with a cannula makes me feel like I'm increasing my safety rather than doing this with a needle. Just now smoothing the transition here from this supra-tip break down to the tip. Perfect.
Very nice.
So definitely see a little bit of a lift and a new bit of definition at the nose tip. Always looking for any form of discoloration or any blanching or change in skin color. So let's continue this treatment now. As we get to this point, which is 30% up the nose, we're going to start to feel some resistance, which is where the nasalis muscle is, and we need to then start to move into layer 4 of the nose. There's a bit of resistance, and we just push through. There we go. And now what I can do is start to work on this light reflex, which is giving the nose this definition. And this is where you can have this optical illusion of creating a slimmer nose by actually adding volume. And I'm making sure that my cannula goes all the way up to these lateral aesthetic lines that we have drawn on, so that we're starting to smooth these irregularities that exist in the dorsum.
And you're doing a mixture of antegrade and retrograde here?
Exactly, yeah. Generally with cannulas, I'm doing both at the same time. And I'm always moving, which I want to do with a cannula, especially in higher risk zones. I'm always moving the cannula.
You're using your non-injecting hand almost as much as you're using your injecting hand, just to stabilize the tissues, to feel what you're doing.
Precisely. Here we just get that little tip, help to create that projection. Now let's take a look. I haven't done above the dorsal hump yet, I've just focused on the lower 2/3 of the nose.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
How are you?
Yeah, I'm doing good, thank you. I was wanting to ask, how long does it last?
This nose filler will last about a year.
Oh, wow, okay.
Yeah. Great, so always midway, I'm just checking the perfusion of the nose. I'm happy when there's a touch of bleeding coming through my entry points. That's a good sign if you see this. Redness coming through with the gel seeping out, that's a good sign that we have perfusion. Mm-hmm. I really like how this is looking from
That's really
the
nice.
side profile. I obviously need to treat this area above the dorsum. Let's continue the treatment now. I'm making another entry point. This one's just going to be a little bit sharp because I haven't done some anesthetic here, okay? 1, 2, 3. Well done. Again, I'm just going to leave this needle there for a few seconds. And then we have to again track down to layer 4 of the nose. So we'll feel a bit of resistance and we have to push through there. Now I'm going to be able to treat the upper third of the nose in the same way. Well done.
How high are you going here?
So I'm going up to where the upper lash line is, which demarcates where I want the start of the nose to begin. And I don't want to be any higher than that, otherwise it will start to look like the nose is starting from the forehead or the glabella, which is where we start to look unnatural.
Yeah. It's a bit of a giveaway that someone's had filler in their nose when you lose that transition point.
Yes, exactly right. Okay, so we're starting to see how we can create a lovely straight nose. This view from the top is the best view for looking at midline features like the chin or even the forehead and the nose. And I can see this light reflex straight down the middle. I can see some irregularity on this side. And I also want to create a more narrow nose. And so I'm going to do another strip down the midline to really try and bring out that definition and narrow appearance. So let's start off by, first of all, addressing this tiny little area of irregularity. And then let's create a more defined strip. So I'm starting to inject and slowly bring it down. And we'll do the same again one more time from this entry point, continuing over the top of the dorsum of the nose, over the dorsal hump, I should say. Don't inject additional volume where the projection is. So we would stop injecting here, and then we would start injecting again after the dorsal hump, bringing that all the way down. Stop there. The final job is to massage, shape, and check for cap refill. So from this view that I have here, very happy with the light reflex. I'm very happy with the aesthetic lines. I'm very happy with the cap refill. From my lateral view, I can see that I've elevated the tip. I've created a new defined tip of the nose. And again, I'm happy with the capillary refill. So now let's take a look from the front. If you just lift your head off, look into the camera. Okay, slowly turn this way. And slowly turn this way. Back to the center. Happy?
Yes, I can already see it. It's great.
Great.
It's so good. It's fantastic.
Thank you.
No problem.